Antimicrobial resistance is when bacteria evolve to resist the antibiotics we've designed to kill them. That can make infections difficult to treat or even impossible, and that is driven by overuse and misuse of antibiotics, particularly during respiratory season, in which case we have a lot of cold and flu going around, which is often caused by viruses. And antibiotics do not treat viruses. We depend on antibiotics to make it safe for us to treat patients with chemotherapy, to transplant organs, to replace heart valves safely. Um, so the risks are tremendous, and there's a lot of infections going on due to antimicrobial resistance. We have 2.8 million annually, with 35,000 deaths due to AMR, and it's increased 460% since the pandemic. So AMR is on the rise. Diagnostics are really our pillar of public health response that help us address the unknowns of infections and direct prescribers to the appropriate treatments. It helps us identify whether we're treating a bacteria or a virus, and that helps us only use antibiotics when they're appropriate. Second is antimicrobial stewardship. We have teams of laboratorians and pharmacists and prescribers that are dedicated to making sure we communicate the diagnostic results efficiently so that we can only prescribe what's needed for how long it's needed, just to the right patients. And lastly is we have the Centers of Excellence program that we've launched at bioMérieux, which is a partnership with 14 hospitals around the world dedicated to sharing the expertise of antimicrobial stewardship and diagnostic utilization to make sure that we steward our antibiotics well globally so they're here for future generations. Innovative diagnostic technology is helping us identify what pathogens we're treating and use antibiotics more wisely over the past several years by increasing the speed at which we get these answers. What used to take 2 to 5 days for us to identify a patient with sepsis and exactly what bacteria and what treatments were needed is now down to an hour after a positive blood culture, which has made tremendous improvements in the care of patients with sepsis. This technology has also reached the physician office and urgent cares in a way that it allows us to diagnose respiratory infections within a span of 15 minutes in many cases. This helps us only use antibiotics when they're needed and leave those viral infections for supportive care or antiviral treatments. What I want people to know this cold and flu season is to use good hygiene. Cough into your elbow, wash your hands frequently, try not to touch your face in public, and stay home if you're sick. Second, follow CDC recommendations for influenza vaccines. Everyone 6 months and older should get an annual influenza vaccine, except for in rare circumstances, in which case you want to talk to your doctor and see if that's appropriate for you. Lastly, we want to change the perception patients have when they're walking into an urgent care or their physician's office. Seek answers. Don't seek an antibiotic. Oftentimes that answer is going to come from a diagnostic, and you'll be able to actually get the treatment you need for the condition you have, and we'll be able to save antibiotics for future generations. Lastly, visit our website at bioMérieux.com/AMR for more details.